It's abnormal for a pregnant woman to have to travel 3 hours to deliver their baby.
It can be a matter of life and death for the mom or the baby.
My heart did stop, so they had to restart. This job almost killed me.
I'm in Northern Ontario because up here, if you're a pregnant woman, you likely have a problem. There's probably not a doctor in the town where you live who can deliver your baby. So what do you do if you're pregnant in this part of the country?
This is the area I'm talking about, from Timmins in the east to Thunder Bay in the west. And our story starts here, in the town of Hearst, population 5,000. I'm here because in Hearst, there's nobody at all to deliver babies.
So get you to lift your shirt. We're gonna go measure. It's all the way up there. How's your breathing?
Better.
Better?
I feel like
Mireille Morissette is at the local health clinic for a checkup. Now you'd think this would be an exciting time, but Mireille is anxious.
So fetal fundal height is 37.
Like since I'm at 37 weeks, I was starting to get worried. Like let's say last night, my labor would have started. What am I, like, do I go to the emerge here? What do I do?
Yes.
Okay.
Mireille knows there's no obstetrical department at her local hospital. The nearest one is hours down the highway, and often in winter, driving's not an option.
144. Great.
Well, the roads were closed last night. Even if I wanted to travel, let's say my labor would have started since I'm at 37 weeks, that's a possibility. I couldn't even travel because the roads were closed. What do I do in this type of situation? Do I risk my life traveling on bad roads? Or I risk my baby's life by staying here? Like, I don't understand.
I don't recommend, especially with the road conditions, that you try to go yourself. That's why that recommendation, unfortunately, is to relocate.
I was just wondering because
Relocation is the policy here.
vitals here.
It's Nurse Fortin Ukrainitz's job to tell pregnant women that to be safe, they need to move to a town with obstetrical services weeks before their baby is due.
Nice and relax.
What are the consequences that you see of women having to relocate?
I think it's terribly stressful for moms, and I think that it can have an impact on how you imagine your life. So some people may, change they want 3 kids. Well, knowing that I can't deliver safely in my own town and I have to travel and have those increased risks, they might change their whole life because of that. 116/81, excellent. Rate is 90.
Mireille's options are to drive 3 hours to the east to Timmins, or she could go west and drive 5 hours to Thunder Bay. So imagine you're 37 weeks pregnant, you've been told to relocate 300 kilometers away from your home. Let me show you what the roads are like. This is the Trans-Canada in Northern Ontario. In winter, it's never a sure thing that the road will even be open because of the snow. And cars get stranded here all the time. I make it to the town of Kapuskasing, an hour away from Hearst. I'm here because I want to meet the doctor fighting to get more obstetrical care in the north. Dr. Jessica Quapis is the chief of staff at the local hospital.
This is not okay. The government says that we need care in the right place at the right time, and that is just not happening here. It's not equitable, it's not fair. This is not universal health care.
For now, Dr. Quapis says she's been able to patch together doctors with obstetrical training to come north part-time, but she says it's far from a solution.
What worries me is that a mom and or her unborn baby or her newborn baby will die as a result of lack of this coverage in our area. I've worked in the third world before. That is a reality overseas. I never thought it would be something that we'd be talking about here in Ontario.
Dr. Quapis presented a plan to the provincial government months ago to increase funding, but she says she hasn't heard back. I contacted the ministry, and they say they're still analyzing the proposal. One of the people Dr. Quapis hired to fill in this week is Dr. Richard Claveau. He used to work full-time in obstetrics in the north, but he says it was too much.
So I would often spend 24 hours up just delivering babies, going back to the office the next morning, and then, trying to rest what I could. At certain points, you don't want to get up in the morning, you don't want to go to work. You know that this is going to be a hard day, or they've called you at 2 a.m., so can't fall asleep again until 6 a.m. type of thing. So I would often be going into work exhausted. Good. Excellent.
For 5 years, Dr. Claveau was the only doctor with obstetrical training in the town of Hearst. And he says one day it almost killed him.
I started feeling unwell. So I was just getting more and more pressure and more feelings of dizziness and weakness. When I looked at myself in the mirror, I was green. And I just told my partner, I said, we have to go to the hospital. This is a heart attack. This is what's happening.
Dr. Claveau needed months to recover. He never went back to full-time practice. But now he says he's under a different kind of pressure.
I can't walk in town now without being asked, like, when are you going to start over? Why did you stop working?
I mean, do people get angry at you?
Absolutely. Like, nothing physical, but people are upset, absolutely. Because these patients have to travel and does increase their risks quite a bit. So the guilt is always still there.
Vroom, vroom. What about this one?
Cheyenne Fournier was a patient of Dr. Claveau's. When he quit, she had to relocate all the way to Thunder Bay to deliver her baby.
When you relocated to have your baby, what was the hardest part about that?
It's very isolating because I would wake up, you'd stay in the house, and you're just literally there to wait. You're there to wait to go into labor. This should be the happiest time in your life, right? You should be able to share the joy with people around you and your family, and you should be doing all of this nesting and folding all of the baby clothes and preparing all of the nursery and all of that. But then you're just there and you're stuck. What does your book say? It adds a lot of anxiety and a lot of stress.
When Cheyenne relocated, her husband couldn't come with her. He had to work.
So my husband works along that roadway when we traveled, and I actually stopped in to basically say goodbye. And I said, I'll see you in a few weeks, knowing very well that there's a possibility that if you go into labor, you might deliver without your partner. What if he doesn't make it? What if he misses the birth of his first child?
In the end, Cheyenne's husband made it. But she tells me that because of the experience, she's changed her family's plans.
Will you have another baby?
That's a good question. As of now, the answer to that is no. Mwah.
Mireille Morissette is just a few weeks away from having her baby.
Bonne journée, Gwen.
And she's still planning exactly what to do.
I have to look at all the possible scenarios and figure out what's best for my family, for my mental health, because I know one of the reasons I wasn't feeling so well during this pregnancy was caused by anxiety of not knowing how my delivery is going to go.